Hello, Chicago, and welcome to Community Post. As you know, it is our bi-weekly CAN TV program that features local leaders and community organizations. Community Post is presented by Foxglove Alliance, HC3, Hectone Nurses for Humanities, and the Academy of Medical Surgical Nursing, Chicago Chapter 317. We are so fortunate to have Dr. Randy Smith in our studio. You guys are in for a great discussion today. Thank you so much, Dr. Smith, for joining us.
Thank you for having me.
Yes. So we'll go ahead and get started because I know we have really good conversation that is going to take place. You and I have had many discussions, so we're going to jump right in. We're going to have you introduce yourself to our audience and tell us, who is Dr. Randy Smith?
I am Dr. Randy Smith. I'm originally from Atlanta, Georgia. My mother was a homemaker. My father was a law enforcement official, so I guess service might be in my blood.
Certainly.
And I've been on a wander where I've ended up in Chicago since I've been with Northwestern since 2012, and I try to stay young.
Yes, that's the key. That's the key. So, we've had discussions about COVID and the pandemic.
Yeah.
And I know our audience is thinking, are we still talking about this? Yes, we are, because the impact of it is still lasting, especially with our healthcare providers. So can you describe your current role and then your role during the 2020 COVID-19 pandemic?
So I am the unit medical director of a general medical unit at Northwestern Memorial Hospital in downtown Chicago. I took that role starting in September 2014, a couple years after I joined Northwestern. And so I served in that role before, during, and after the pandemic up to the present.
Oh, wow. I did not know that. I knew that you were medical director. During the pandemic, were there additional responsibilities added to your role as medical director? What do you think was the most significant part of being a medical director during the pandemic?
So from an operational perspective, I was asked to coordinate all of the medical units' response to the COVID pandemic. So to come up with the best way to respond clinically as well as operationally with interface with our emergency department and our ICU, and to kind of organize our general clinical response by physicians and nurses to patients who were admitted with COVID-associated illness.
Yeah, and that was a short time frame to be able to do that. When you think about from when the pandemic first started to intervention, it was very short for all of us, professionally and personally.
I would describe it as flying up as having to build the plane while you fly it.
Yes, exactly.
Yes.
For sure. And I think we're still building some of that plane or trying to come down a little bit for landing.
Absolutely.
If you could summarize your experience in 3 to 5 words, which words would you choose and why?
Personally, I would describe the COVID pandemic as an opportunity for the soul.
Oh, wow. Okay. That's really deep. Tell me a little bit more about that.
Well, I think all of us, including healthcare providers, we face this pandemic where we didn't know what it was in the beginning. We knew it was harmful to us, and there was little understanding about it, little understanding how to treat it. And I think each of us individually, or many of us, I should say, we face this just overwhelming existential fear.
Yes.
And it was this fear where you kind of you discovered that there was nowhere to hide, there was nowhere to run, there was nothing you could really do. You were probably going to get it, is at least what I thought. And there wasn't any treatment often, on at the time. So ultimately, I think this fear was something that was just completely overwhelming.
Absolutely. Oh, yes.
And for myself, and I think for many others around me, it put us in this very overwhelmed, existentially empty place. And you're kind of overwhelmed, and you kind of look at what's happening around you as a provider, and you look at the suffering around you.
Yes.
And you say to yourself, well, I don't know what to do. I don't know if there's anything I can do at all to help myself or anybody around, but at the very least, as a provider, it's an opportunity to look at the world and say, this world of suffering unaddressed is just something I'm not going to abide by. I'm going to choose to have a different world and act to make at the very least a statement that we're not going to witness suffering without response. So you move yourself to just start to do what you can.
Do what you can.
And then as we learned about the pandemic and we learned about treatments and ways to protect ourselves, and you find yourself able to use those tools in order to start to try to do a better job than simply just making an expression of a desire to address suffering.
Yes.
And I think that that transformation is what I went through, and it's what I think a lot of my colleagues, especially nurses, went through.
Yes.
And you are in an area where you're working with other people, seeing other people go through these things, these types of transformations at various levels, and you kind of work off each other and riff off each other to grow and come into a new place for your patients and for yourselves.
Yes, certainly. As you were speaking, I'm just reflecting. I'm a nurse, by background, and I just remember having this moral pulling in the inside. It was personally, I need to be here for my family. Professionally, I need to be out using my tools to save the world. And it was a battle. It really was. And there were, lots of nurses and healthcare providers who still speak about this internal pull. We're going to come back to that. How did the unit that you were in charge of respond to the challenge of the COVID-19 pandemic, specifically the frontline nurses?
Sure. Well, before the pandemic, I think our unit had developed a culture of open communication where, we think about the workaday of taking care of patients and clinical questions that come up. And it was a unit of open culture where I've always encouraged and almost kind of enforced our hospitalists to embrace this notion that any team member can bring up any question or concern about patient care openly. So we try to foster a culture of open communication, which we then support by leading by example and showing examples which we support. And that foundation existed before the pandemic. So when the pandemic came upon our units, what we found was we had this foundation where people could be open, but we needed to open up the topics that we were going to discuss about. In particular, how are we going to respond as healthcare providers to taking care of our patients and all the issues around that, but also how are we going to respond and cope as a team? How are we doing as individuals in the midst of this? And this foundation of openness had to widen, because I think, in all honesty, we were discussing things about ourselves and each other that you wouldn't necessarily talk about with your colleagues during, outside of the pandemic. And after the pandemic, that aperture has closed back down. But it's important, I think, to have that foundation of openness so that you're prepared for a stressor like a pandemic, because we needed to have that to be able to kind of speak openly, not only with regards to the work that we were doing for patients, but also what we were going through.
Yes. In your opinion, do you think nurses or healthcare providers have healed from the impact of the pandemic? And before we get to that, can you share some of the challenges or the changes that transpired on your unit? I know our audience probably remember, images on the news where families had to speak to their loved ones or say goodbye to their loved ones via an iPad. And some of the images of nurses, healthcare providers not even being allowed in the room. And when they were in the room, it was, garbed from head to toe. So some of that humanistic touch was missing, so to speak. Right.
I think, going back to this foundation of openness and being able to speak openly, it's tempting for someone with experience or expertise to kind of stand aside and say, well, you should do this or you should handle it this way. The reality is each of us are at different journeys as healthcare providers. And you have to have this very organic way of meeting your colleagues where they are. And being able to kind of speak through and live those things with your colleagues certainly having patients who were isolated, where they couldn't see family, and where we even had to gown up and take a lot of time to be able to get into the room to take care of them, even for the most mundane things, was a significant challenge. But there was something about all of us going through that together and being able to see from each other's examples of best ways to optimize that. My unit's going to be different from other units. My hospital is going to be different from other hospitals, and the communities that we take care of are going to be different as well. And there really is no replacement other than being very organic and living in the moment, to just experience what you experience, share it with your colleagues, talk it out, talk through difficulties, try through new things, see what works, and just continue to live the moment organically.
Yeah. And those things don't work. You go back to the drawing board, you figure it out.
Sure.
But I think the most compelling thing is that team approach and that team atmosphere.
Yeah.
I remember one of the campaigns, we're all in this together.
Yeah.
And for that moment in time, we truly, truly were.
Yeah.
Gosh, those images, like, they're replaying in my head about you think about like the grocery store where people were, putting on just the most insane things to cover themselves to go get groceries, and, the gloves and the masks. I think we've learned so much, from that experience. What suggestions do you have to continue to facilitate healing? Because as I mentioned before, a lot of healthcare providers are still trying to heal from the things that they saw, the things that they felt, even some of the things that they heard, right? When you're with that iPad and someone is, transpiring, hearing the loved one say goodbye and the crying, and it's absolutely nothing that you can do.
Yeah.
Like, that stays with you.
Yeah.
During that pandemic, I actually worked the COVID hotline. And a lot of people think, oh, you were just like scheduling appointments, answering questions. No, there were people in distress who were calling.
Right.
You could hear the distress. And if you remember, at that time, we didn't have a lot of ambulances and paramedics that could go back and forth and do those things. So people actually did transpire while you were talking to them. So you had that sound, and those visions continue to replay.
Sure.
And as you can see, I personally have not healed, right, from the things, the loss of family members and, all of those things. So what suggestions to facilitate, I would say, to continue to facilitate healing, would you suggest?
Well, I think it's an excellent question. And I think to frame the answer, I think the first thing we have to recognize is that there are some of our colleagues who did not heal, that actually ended in a place where they unfortunately took their own lives. And those people take with them lessons in a story that we will never be able to completely hear, which is its own compounding of the tragedy of their loss. But for those who can still hear this interview, I would say that if you're breathing, you're healing. That we are built to heal, and that any healing that was taking place at the time in 2020, 2021, when we were caring for these patients, we're still on that same arc, each of us as individuals. I remember seeing a patient who was dying, who was DNR and on our unit, so it was not in the ICU, it was in our floor unit, and he was dying, and he was awake, and I looked at him in his eyes and told him he was dying, and he never closed his eyes. He died looking at me in my eyes, and that's something I still carry. This openness of talking about it openly with your colleagues who have walked that walk with you is very important. And I think there's a lot organically that just happens with, again, we were built to heal.
We're built to
so
heal.
if you go through time, continue to remain committed to your mission, continue to look honestly at what you're feeling and express it with yourself and with others, that will help a lot with healing.
Yes.
I think sometimes also you wake up and you just kind of don't know what to do, and you might feel lost or overwhelmed. And in those situations, I would, my recommendation is to do to feel. That's what I say. I think it's tempting to think, well, I don't feel like doing something, and maybe I'll wait until I feel better in order to do something. But the healing actually might flip this, that instead of waiting to feel to do something, pick to do something to make you feel. And if you can think about things that are healthy to do, you know, diet, exercise, rest, getting with friends and family, being socially active, you know, taking time to explore something, to learn something. Nobody has ever regretted learning something, right?
So true.
And you may not feel like you're ready to do this, but if you just do it, and you'll find that if you keep doing something that's healthy, that you will find that you heal, that your body will take over, your mind and heart will take over to start to heal, to grow into a better place. You know, and frankly, a lot of these difficult things that we've experienced with patients and that we saw patients and their family members see, we probably, you know, we shouldn't forget them. They're never going to go away.
Absolutely.
But the purpose of this, you know, what I'm speaking about in an informal way is what we call post-traumatic growth. And there is this kind of operational, useful, tactical thing of, you know, preparing yourself to be better prepared from a resilient standpoint in order to face something like this in a more effective way in the future. And everybody benefits from that.
Yes.
But a deeper thing here is to actually grow for yourself and for the people that love you. And that's the real purpose of growth, really, is to develop yourself for your life, to experience life.
Oh, I like that. I like that. And had we not been doing this interview, I'd have grabbed a pen and wrote that down so that I can remember that. You know, one of the things that, you know, I did was journal. Journal. Being able to express those things. My immediate family, they're not healthcare. So being able to journal that and actually talk with, you know, other healthcare providers about what I was feeling. I also felt like, you know, it was very hard to express what I was feeling because I had to care for and lead my family at the same time. So, you know, you put yourself on the back burner and you rise up to an, you know, an informal or formal leader.
Absolutely. And I think it's important to recognize that in this healing process, you know, you can't be in systole all the time. You have to be in diastole as well. And there's going to be a moment, and you'll know when the time is right relative to what's happening around you. There's going to be a moment where it's time to take your foot off the gas pedal and just kind of say, okay, I need to take a break here. I need to sleep. I need to do something else. I need to see my family. And, you know, that's natural and expected. You know, you do have to make choices and step up to the challenge of the moment. But it's also natural and necessary in order to step away at some point because we're all human.
Yes, yes. You know, I just go back to the quote, you know, you can't pour from an empty cup. You have to be able to refill yourself and reset yourself. And as you stated, sometimes that means stepping away.
Absolutely.
And sometimes it's a very hard thing to do, but it is essential to do that.
I found that, you know, there might be fear that people around you will respect you less for stepping away, but actually what I found in my experience is being honest with yourself and showing an example that you're human and that you're able to, you know, kind of recognize this in yourself and step away is the responsible thing to do and becomes a method of leading by example to show that others can be healthy for themselves as well.
Yes, I love it, I love it. So that my next question was gonna be, you know, what was some significant lessons that you learned personally and professionally? And I think that you've answered those questions.
Well,
certainly.
I will take this opportunity to be a little technical from a quality improvement perspective because, you know, that's one of my passions. You know, this culture of openness that I talk about with regards to the mental, emotional, spiritual ways for staff to cope and thrive. It also had clinical care and operational effects as well. A lot of institutions took this approach of kind of saying, well, we're going to have some sort of web-based resource where people can go for the best answers on, you know, policy and protocol and, you know, evidence-based care for COVID and things like that. And those could be very, very accurate, but they could be late.
Yes, very true.
But even if they were on time and accurate, my staff in the unit, including the physicians and nurses, just felt like they were being written by somebody who just wasn't there and wasn't able to kind of touch and feel what was happening with patients on the ground, So there's something about having a node of information at the unit level where people can raise questions, interact with, and even if it's just the same copy of what's being copied from the CDC or from your hospital leadership or whatever, if you just have that same node of dynamic information in the unit, people feel like they have a piece in it. People feel like they have a say, and they feel because of that, they feel like they can trust what comes out of it.
Yes.
And it becomes a node of coordination and information that a unit's able to use in optimized care.
Yeah, and real-time information.
Yeah. So professionally, that was my biggest lesson in running a unit, is that somebody still has to put in the work to be that lightning rod of questions and concerns to come up with best practice to communicate back to everybody. And that takes personal work to do. There's no way around it.
It does.
And as far as personally is concerned, I mean, these lessons that I've shared, this advice I've shared, a lot of it I learned during the pandemic the hard way.
Yes, I think many of us definitely did.
Yeah, you know, and this isn't really something I think that comes from theory. It's something that comes from, you know, having lived through it.
Yeah.
I think looking in hindsight, it's easy to think that maybe the pandemic really wasn't that bad, but you got to remember in March, April 2020, we were dealing with something which was encompassing all of society that we didn't understand, and it felt like we were going to war.
Yeah, for sure.
And I would just say that these, you know, lessons of coping and healing that we've talked about, I think these are things that if you don't believe them, at least maybe give them a try or trust that they're going to catch up with your disbelief.
Yes. No, so very true. I think one of the lessons that personally that I learned was the notion of slowing down.
Yeah.
Slowing down and being intentional about time. Yeah. So, you know, I still try to apply that to today. But of course, you know, the world has caught back up, right? The demands have caught back up.
Sure looks that way, doesn't it?
So definitely, you know, trying to just operate in that, slowing down in intentional time. What advice or words of wisdom would you offer to our audience? Our audience, one, and then to healthcare providers, two.
Well, I think it's the same for both, is what I would say, is that, you know, crisis in life comes in different forms. It can come by the second, or it can come over the course of weeks to months. And if, you know, we know about healthy things that we can do, we know we have to take care of ourselves, but then the other option becomes, well, that's great, but I'm still a person living in society, living in the world. I have people I care about that I need to interact with. And my tip is that whatever crisis you find yourself in, if you don't know what to do, keep moving.
Yes.
And do the next best thing that comes to mind. That it might be, if you're at home, just cooking dinner. Or if you're in the hospital, it might be, well, just going to get blankets for the patient because they seem cold. Or just thinking about, you know, if you're a physician, looking over the lab tests and seeing if you want to order something new. It may not be the right thing, it may not be the best thing, but if it's the best thing that you could come up with at the time and you keep moving, one, you'll continue to grow and stay active. Two, you won't have a lot of time to worry because you'll be doing something. Three, everyone else is going to see around you what you're doing. And they're going to learn from what you're doing and say, hey, that works, I'll try it too. Or they'll come to you and say, hey, don't do that. I've got something better you can do, right? Or I've got something better you can read. It demonstrates what's happening in your mind outwardly so that you can actually maybe, you know, learn something and develop and grow and interact with others and learn from each other and teach others by example. And hey, you might even be doing the right thing.
You may be doing the right thing. Oh no, I love that. You have shared just such valuable information. Are there any key points that you would love to share? And I do know that we have our Hectone Institute COVID monument, that's going to be coming out very soon. So, you know, where nurses can share their stories and you can honor nurses and healthcare providers. Any other key points or highlights that you want to tell our audience?
I would just say, you know, with everything around the COVID pandemic in society that's happened, a lot of it we haven't touched on, but I would just say ultimately what we've discussed here I think is your growth as an individual, and you own that growth and that growth is for you. And if you've grown well and continue to be honest with yourself and be focused on your growth, you will become a shining light and a resource to those around you. That ultimately, that's something that's for you in the end, and others get the benefit from that.
I love that. I love that. You spoke a lot about like role modeling, and then this just additional growth. So I really, really hope that, you know, Chicago, our audience have tapped into that and lean into a lot of the things that were discussed. I feel like we need to have another part of this series to this. There's just so many things I want to discuss. We are a resilient city.
Yes.
We are definitely, you know, resilient healthcare providers. And I'm very proud of the way that we have bounced back, certainly, from the pandemic. Lots of work to be done.
Sure.
But, you know, like you said, crises happen in all different types of ways.
And we get to work together and grow together, and that story is not done, and it never really is.
Yes.
And what a great fun time it is.
Yes, yes. Thank you so much, Chicago, for tuning in. We want to just take this moment to thank CAN TV. You can catch the show and other shows on Channel 21 and cantv.org. Also want to send a thanks to Fox Gov Alliance and HC3 Chicago, AMSN Chicago 317, and of course the Hectone Institute. Have a wonderful day, Chicago. Stay safe. Bye.
Take care.